Now I'm wondering then, after these initial investigations, then the chemotherapy and the radiotherapy, everything seemed to be going well. Was there much time until the actual surgery occurred?
Well, communication did seem to cease. I did expect an appointment, albeit the appointment for surgery to be a month, 6 weeks down the road, but I expected a date, but I didn't get a date. And when I was contacted by Mr. Thomas, he said that one of the scans, I believe it was the MRI, revealed an abnormality in an adrenal gland. He said don't get too concerned by it, but he wished to investigate further, and that involved something called a PET scan, which is done in a mobile unit. And so I had an appointment, kept the appointment, and the results of that weren't sort of explained to me precisely, but nevertheless it was deemed that it would be a good idea to remove the adrenal gland at the same time as had this cancer surgery. Right. Which I can fully understand why meant that you had to get two guys together on the same day, both who had, I'm sure, busy workloads, so that would make it more difficult than the one, and they presumably had to operate in tandem and had other things to do that day. So I could see logistically it wouldn't be easy.
So you actually had two surgeons operate at the one time on those two separate areas. So
precisely.
You had one anaesthetic, and then afterwards, you had that result.
And once I was getting ready to go down to be anaesthetised, they both individually came and introduced themselves to me, which was nice in one way, but I have got a little anecdote about that. Because there are two adrenal glands on the human body, a left and a right, and when Professor Nicholson came to introduce himself, which I didn't expect, so Mr. Thomas probably, because I had quite a lot of dialogue with him, but he did say, I believe, I will be operating you today, I'll be removing your left adrenal gland, and I'm sure, I was positive that it was the right one. And I mentioned this to him, and he said, don't worry, I'll go away and bring it up on the system, some computerised system that accessible to him at the time, or should have been. But he came back in and said, unfortunately the system was down, but he says, don't worry, we have that same system in the operating theatre itself. But I sort of got rather worried by this. It's almost like something out of a comedy sketch. But so I did get taken to the wheeled down to be anaesthetised. But I was talking to anyone who would listen, possibly the cleaner, anybody, to make sure they get the right one, sort of thing. But,
you were shouting out.
Yeah, well, I was talking to anybody who might listen. So some of which probably were irrelevant, but it was a bit like the sort of musical joke of the bloke who has the wrong leg removed. I knew it, part of me, that they know what they're doing, but it isn't the ideal sort of conversation to have immediately before you go down.
No, that's anxiety provoking for sure.
Yeah.
But let's cut to the chase. You then came round from the operation. What's your recollection of that?
The recollection of that is being very cold, very, very cold, and shivering in an involuntary manner.
But was it on your mind about the left and the right?
I don't think so, to be honest. I mean, when you come round, it was where am I was it didn't pick up on everything straight away. There was like a recovery area, and there was a guy, presumably an anaesthetist or so, keeping an eye on me, and I think I later learned that they had trouble regulating my body temperature, and so I stayed there for longer than probably is normal, and which caused concerns for my wife, because I went down in the morning and still wasn't back at 8 o'clock at night.
Now, what was the overall result as far as you were told? How successful were the joint procedures?
I wasn't told there and then, obviously. The first time I was told was within about 24 hours. I was visited personally by Mr. Thomas, who said everything had gone well, and said he was pleased with the way things had gone. So I thought, well, if he's pleased, I'm pleased.
So he was pleased, but did you later, when you came back for that review, receive any further details about anything that was sampled at the time, any staging, the outlook in general, any further kind of refinement?
No, to be honest, no.
Did you ever receive that information?
Not that I can recall, no.
And what does that mean in terms of your confidence now for where you are?
I just try to be optimistic. I suppose one of the most reassuring things is, even prior to diagnosis and all through the whole piece, I have felt and appeared to the outsider relatively well.
And is that reflected in your day-to-day function, meaning your activities are essentially preserved?
Ironically, it did initially for quite a long time, because I did suffer a domestic catastrophe which sort of took my mind off things, and I did concentrate all my energies upon that. But when life settled down and ultimately I realised that I couldn't continue with my work-life sort of balance, I did sort of encounter problems, mental problems, depression.
Let's talk about that in just 1 second, if you don't mind. We were talking earlier there about the recovery period. How long were you in hospital for?
A week, exactly a week.
And do you feel that you left hospital optimistic that things were going to improve?
Pardon me. I left hospital feeling queasy. I wasn't sure that it was a brilliant idea, because I had to wait in a waiting room, and it seemed that the decision to release me was made by Dr. Thomas, or Mr. Thomas, and I sort of wasn't expecting it, and I didn't. A day when I was probably felt a bit more queasy than I had done. So, and my wife, having visited me the night before, she didn't expect it, with the result that she was at work, and she did come and fetch me, but it took an hour or two, and I felt rather ill in this sort of area where I was given to wait whilst waiting for her, and in the end, I actually went and lay on a trolley somewhere near to where the whole adventure had started when I came in, courtesy of the nurse who was looking after things, just to make me feel more comfortable. So really, I didn't feel, much as I said, I felt well through the whole piece. I probably have felt as bad as I ever have on the day of discharge.